Hello guys. In this lecture we will be discussing about the forest plot. We will be discussing what actually a forest plot is and how we analyze it or how we read it and where it is being used. First of all, keep in mind it has nothing to do with a forest. We all know that a meta-analysis it involves a statistical method that consolidates results from multiple studies to provide a comprehensive overview of the impact of a particular intervention or treatment. When we look at the level of evidence, systematic reviews and meta-analysis, they are at the top level of evidence. And as we go down, then the critically appraised topics, critically appraised individual articles, then randomized controlled trials or RCTs, then cohort studies, no matter they are retrospective or prospective, then the case controlled, case series and reports, etc. And finally, the weakest evidence is of background info and expert opinions. So whatever is the topmost in when we look at this pyramid of evidence, that is supposed to be the best evidence. So meta-analysis find extensive application in various fields including medicine and healthcare among others to provide data-driven recommendations for the clinical practice, policy development and guiding the future research endeavors. Meta-analysis, they use statistical methods to analyze the results of several studies so that we consider those as a single study. And this method requires that these studies have comparable research designs and figures. If this is not the case, the publication will be a systematic review. We are not going to consider it as a meta-analysis. So this is the main difference between the two, though both are considered as the best among all other type of evidences. This is in among the topmost when we talk about the evidence. Why we use the forest plot? So it is analyzing numerous papers which address a common research question would be a challenging task when we will be performing the meta-analysis, especially when these papers they yield disparate conclusions and present varying statistical evidence. Either they are supporting or they are refuting an association. A forest plot serves the purpose of aggregating all the pertinent studies investigating the same question, identifying a common statistical metric within these papers, and presenting them on a unified axis. This approach facilitates a direct comparison of the findings and their associated quality from these studies within a single comprehensive visual representation. Now, what is a forest plot? A forest plot serves as a visual representation of the outcomes from a meta-analysis. This is a forest plot which is available on the internet, and even in various exams they give this forest plot and ask questions on the basis of this forest plot. So most of you would be familiar with this forest plot. So it presents the results of a meta-analysis by showcasing the effect size and confidence interval for each individual study along with the overall summary effect and its confidence interval. Each individual study is represented by one horizontal line, this one, with the length of each line indicating this length, indicating its extent of the confidence interval, which is also written over here. Now let's analyze the forest plot. This is another forest plot just to show you that there are various forest plots which are available and how you can make those. First of all, let's discuss about one part of the forest plot, and that is the axis. This is the horizontal axis. And here on the horizontal axis, it represents the statistical and the studies being profiled. This could either a relative as an odds ratio or relative risk ratio, or it could be an absolute one like absolute risk reduction ARR, or standardized mean difference or standardized mean deviation. So here we can see that. This is the line of null effect, which is on the y-axis. So the vertical line is known as the line of null effect. This line is placed at the value where, as the title suggests, there is no association between an exposure and outcome, or no difference between the two interventions, like if we are comparing two interventions. Now these numbers, these are the scale for statistics, either odds ratio or relative risk, like in this example, in this particular example which we are discussing. So relative statistics like OR or RR have a null effect of 1. For absolute statistics like absolute risk or ARR or SMD, the null difference value would be a 0. So it will be 0 over here in that case. Now these study lines, these are the different studies. Each horizontal line put onto a forest plot represents a separate study being analyzed. In the figure on this slide, 4 studies are plotted. Each of these studies' result has 2 components to it. And what are those? First of all, a point estimate of the study result, which is represented by this box. Usually it is black, but in this lecture I have just colored it differently. Usually on the forest plot you will find all these lines and these blocks black. So it is a point estimate of the study result which is represented by a box. This box also gives a representation of the size of the study. The bigger the box, there will be more participants in the study. Like you can see difference in the size of boxes in different studies. A horizontal line representing the 95% confidence intervals of the study result, with each end of the line representing the boundaries of the confidence interval. This one, from here to here, from here to here, from here to here. So this is 95% of the confidence interval of this particular study. This will be of this study, this will be of this study, and this will be of this study. Each side of the null effect line represents its, if it favors the control or the intervention. Like here, favors the treatment or intervention, and it favors the control. It could be 2 different interventions as well. It is also important when looking at the individual studies, check if the horizontal line, it crosses the line of null effect or not. It is important to take note for each study in this respect. The 95% confidence interval is the range of values within which you can be 95% certain the true value lies. If this horizontal line, it crosses, like in this case or in this case, crosses the line of null effect, then the null value lies within your confidence interval and hence could be the true value. Remember, any study line which crosses the line of null effect, it does not illustrate a statistically significant result, and usually in the exam, question is asked about those studies which cross the line, and then it is asked that what does it represent. They have crossed the line, so we answer that it does not have any statistically significant result, or it is not statistically significant. This diamond over here, The diamond in a forest plot represents the combined and averaged point estimate and confidence intervals of all the individual studies. A vertical line through the vertical points of the diamond represents the point estimate of the averaged studies. The horizontal points of the diamond represents the 95% confidence interval of this combined point estimate. This from here till here. This combined value effectively groups all the participants from all the individual studies. So this is the combined effect of all these studies. All the individual studies, the confidence interval range for this result should be the smallest on the forest plot. The rule about crossing the line of null effect are still valid even here. So if the horizontal tips of the diamond, if they cross the vertical line, the combined result is potentially not statistically significant. Say for instance it is crossing this line, or even the diamond is on the other side of this line, then the combined result is potentially not statistically significant. And the reason is, if the 95% confidence interval contains the null value, we cannot be certain that the null value isn't the true value. That is the reason. Now, let's see what are all these. So over here, each individual study with main author and year of the publication, they are placed in this column. Then in these two columns, this is small n divided by n. So n, these are the patients, or these are the cases with some outcome, and this is the total number of the participants in the treatment or in any group, and it will be in the control group or in any other study. Like if we are comparing two interventions, so intervention 1 and intervention 2. Again, same, n is the cases with outcome and n total number of cases. Yeah. More important thing is, over here we will be writing the risk ratio and the 95 confidence interval, which would be representing the horizontal lines. So in conclusion, each horizontal line in a forest plot represents a distinct study with its outcome depicted as a box and the 95% confidence interval of that outcome shown as the line. The positioning of each study to the left or right of the vertical line is contingent on the specific biostatistical methods employed. If an individual study crosses the vertical line, the line of null effect, it indicates that the null value is encompassed within the 95% confidence interval. This signifies that the study's result aligns with the null value, signifying that no statistically significant distinction exists between the treatment and the control groups in that particular study. At the base of the forest plot, there is a diamond that represents the combined result when all individual studies are pooled and averaged. The horizontal points of the diamond indicate the boundaries of the 95 confidence intervals and are subject to the same interpretation as any of the individual studies displayed in the plot. Means if they are crossing the line of null effect, then they are not significantly they don't have any significance. Statistically, they are not significant. Now, there is a fun fact. All of you would be familiar with the Cochrane collaboration logo. Do you know what does it mean? Well, look at it again. I am not using it over here due to the copyright issues. So just, you can always Google it. You can find it on the internet or on any publication which is endorsed by the Cochrane, you will find its logo. But if you will look at it now, it will make sense. So there is a vertical line, which is the line of null effect on that. And then there are 7 horizontal lines. And then there is a diamond at the bottom. So basically, it represents the forest plot of the first meta-analysis, which was published in 1991. And what was that meta-analysis? It was about the use of corticosteroids by the mothers of those kids who were expected to be born prematurely. And when the mothers they used the corticosteroids, it reduced the complications of prematurity. Isn't it amazing? Well, for details on our courses and test services, you can visit us at, like our test series, you can visit us at http://www.dentalprep.ca, or you can email us at info@dentalprep.ca, or you can email us at dentalprep@outlook.com. So thank you very much, and I will be back with other many uh, very useful videos for you, and definitely I will try to address to your queries. Thank you very much.